This is part two of the other one. Like I said, people are getting stoned out there by doctors because doctors choose not to, one, investigate their health problems. They choose to just give them some medications, push them along the way, and hope that they won't come back and bother them anymore. Because the doctors are controlled by the health insurance companies. Now the deal is if doctors are supposed to care so much about people, they would run the tests. They would investigate all things to make sure that that human being is well taken care of. So in today's society, you got the health care insurance companies controlling the doctors, and it's all a bunch of bullshit. And we lost our compassion for people as a human race. We don't know how to give each other unconditional love anymore because we're so caught up in our own lives, so stressed out financially, and we ain't got the energy to deal with anything because we're sick or we don't feel good, and all this stuff is a factor in our daily life. Now, if I was the leadership of this government, I'd probably have to fire all of them because one thing, this government is sadistic. They get this grand illusion to other countries that we're this wonderful country giving all these people this stuff. You know, it does sound good. You know, we do get some medical care. And we do get some financial assistance to live by. But the thing is that it's not appropriate. It's not sufficient to meet our needs. But the thing is, here's the deal. They have this system so manipulated, such as when I was working for Unified Health Partners as a home health aide. Okay, I went and got Access Health. My goal was to get the hell off Social Security disability and work. But here's the deal. Anyway, when I went to go Access Health Insurance, had informed me after 3 months of being in their program that, sorry dude, you can't have this Access Health Insurance because you got to have Medicare. I mean, what the hell do I need Medicare for? I don't want that crappy health insurance. But you have an ability to achieve Medicare Part A and B and C and D, and I don't give a crap. But the reality is that it costs $100 and some a month for this so-called Medicare Part B. And my Access Health Insurance cost me $40 now a month. Now, why would I want to spend $100 for a piece of crappy Medicare health insurance program when I know by paying $40 I was getting a better quality of service? Because here's the experiences I had. A few back years, I was in the hospital. I was on Medicaid, Medicare. Well, they did all these tests for 3 days, and by Sunday I was supposed to be released. I was waiting for some of my ride, and here's what they said to me. They said, you need to get the F out of this room so I can clean it. Okay, because I was on the so-called Medicaid, Medicare insurance, so quality for human beings. I wouldn't even put a dog on it. But anyway, after the following year when I had my Access Health Insurance, when I went to the hospital for 3 days, those people were practically treating me like King Tut sitting on my butt. And they'd come in there and make sure I had everything taken care of. Now, there's a difference here. I was paying $40 a month for Access Health Insurance, being treated with respect and dignity as a human being. Whereas on Medicaid and Medicare, I was treating worse than the piece of crap sitting on the floor. And I was paying them more, $100 more. But the thing is, though, that I couldn't afford the $100 to pay them, so therefore I got stuck with a big hospital bill. Because the doctor wrote on there, look, dude, this is an outpatient stay. Even though I was in there for 3 days, it was considered an outpatient. Can you imagine that? So, since he classified it as an outpatient, I owed that hospital $6,000 just to sit there in that hospital and be treated like crap for 3 days. That's the Medicare system for you. Now, I liked my Access Health Insurance. I enjoyed working with my clients because I feel that was my calling. I was a home health aide. I care about people. And I see that as I look around people, we lost that quality of compassion towards one another over this so-called green god that people seem to keep choosing to grab, trying to get that fame, fortune, and wealth. And they keep hurting each other by trying to achieve this dollar, trying to achieve this worldly wealth, and causing much more pain than what is needed. We could all have an equal quality life, but the perception of these people out there are the sadistic. They only care about themselves. And they only care about their quality of life. Hell, the Congress and all these people, they got their health care. Why are they going to do anything better for us? All they're going to do is sit there and bicker and argue over this crap and that crap. But then, like I said, they don't like their tax dollars going for abortion. Well, like I said, I don't like my tax dollars going to feed some damn child molester neither. But that's the way it is. So, get real. Medical and health care should only be about one thing. Go see my doctor. My doctor submits a bill to the government pays it. Clear as ample. Don't be putting your dictator crap in there. And I'm sure if they really struggled hard, they could figure that budget out without all this bullcrap. It's simple. Provide the care to the patient through the doctor